want to go ahead and welcome everybody. Acknowledge that we have a small audience here, but some of you are key stakeholders in community, as well as community-based organizations and other child welfare professionals. I want to go ahead and introduce myself. My name is Patty Ramirez. I'm a program manager in Santa Clara County, overseeing the Children and Youth System of Care, and the SAFE program is one of those programs that I oversee. I want to go ahead and introduce the other presenters. Go ahead and go to the next slide, Rebecca. And I want to go ahead and pass each one so they can present themselves and talk about who they are and what their role is within the SAFE program. But before we get to the introductions, I just want to give you a little bit of a background. In Santa Clara County, what we're doing as part of the community pathway is that we established a program called SAFE, the Strengthening All Families Equitably program, which operates within this framework of the community pathway to connect families, to support before a crisis occurs, support them in community, and so we refer those families directly to community providers. And so you'll hear from those providers today. We'll discuss the successes, challenges, and future opportunities in building the effective prevention framework within Santa Clara County. And I'll go ahead and pass it over to Rebecca Luna for her to present herself.
My name is Rebecca Luna. I am a social service program analyst for Santa Clara County DFCS as well. Prior to switching over to an analyst position, I carried cases in what we call safety and well-being. So everything from reunification to planned permanency. Oh, hold on. Apparently I'm having an issue with my slides again. Let me.
You're good, Rebecca.
Oh, okay. Let's do full screen. Okay. Carried cases for a while in safety and well-being, so everything from reunification to planned permanency, switched over to non-minor dependents, meaning 18 to 21-year-olds, emancipating from our system, transitional housing, those type of college supports, all the things they were speaking about before. That was my cup of tea. And then I went to dually involved youth. However, in all that work, the value of prevention is very, very clear. And that's why I made the shift over. Upstream prevention is really important. And I'll pass it over to Mindy.
Hi, everyone. My name is Mindy Davis, and I am the clinical program manager for the SAFE program at Pacific Clinics. And I can pass it over to Maria Alejandra.
Yes, good morning, everybody. My name is Maria Alejandra Arreola, and I am the Prevention Director here at Rebekah Children's Services. And I'll pass it over to Damaris.
Hi, everyone, and good morning. My name is Damaris Gomez, and I'm the Program Supervisor for SAFE at Rebekah's Children's Services in Gilroy, Santa Clara County. And thank you for being part of our presentation.
Thank you, everyone, for just giving yourself a little bit into and partnering with me in regards to this presentation. Go ahead and go to the next slide, Rebecca, please. So I want to highlight about the goal of the community pathway. We are trying to create that prevention-focused system that strengthens families before any crisis exists. So the aim is to reduce child welfare involvement by providing families with the right supports at the right time, ensuring they have the tools and resources for them to thrive in community. Now, this model prioritizes family-driven voluntary services to empower families rather than responding through the child welfare or probation lens. So what we're trying to do is really invest in prevention upstream. We do this by reducing trauma, family separation, and long-term system cost savings while improving overall well-being. Now, why is this important? As you know, traditionally child welfare approaches are often reactive and intervening only when after harm has been occurred, and oftentimes creating more trauma. Trauma that tends to follow the youth, as you heard the panel earlier today, that follows the youth and the families through their life. So this model is trying to shift the focus more upstream, offering mental health, parenting supports, economic resources early to prevent crisis before they escalate. So we really are trying to strengthen families and supporting families in community by really moving upstream. And what we're trying to do is really build that prevention continuum. Go ahead and go to the next slide, please. As we're working in Santa Clara County to strengthen the prevention continuum, we're trying to ensure that family, regardless of the risk level, have access to the right level of supports that they need. Prevention isn't just a one-size-fits-all approach. Families needing varying levels of support at different times need different interventions. So the prevention is an investment in community well-being. And the more we invest early on in supports, the less that we will see children entering foster care and the less trauma that we're causing them. Youth are going to become more resilient, and families are going to experience hopefully less crises. Key elements of the strong prevention continuum are really primary prevention, where we're really hoping to serve all families out in community to promote well-being. And of course, secondary prevention, the hope is that here we have less of these families in the secondary and tertiary levels, but we know that, in order for us to achieve these goals, we have to start somewhere. So for now, we're really trying to focus on making sure that we're solidifying this strong prevention continuum by enforcing families' well-being in community and building a system that really intervenes early by creating these pathways, community pathways to support families out in community without child welfare involvement. And how are we doing this? Go ahead and go to the next one. What we've been doing intentionally here in Santa Clara County is really helping a develop a no wrong door multi-tiered service of support, or single service as we call it. What we're trying to do is making sure that whatever the level of care the family needs, whether it's light touch and refer, or complex services, high-level services, or acuity services, that we make sure that we map all this out as part of a multi-tiered system of support framework. We're hoping that each tier has the available services and supports for families to quickly navigate and access in community without us having to interfere or have to refer them. The earlier we do this, the better that we can support families, because families shouldn't have to fight for access to services or wait until a crisis hits. So what we're trying to do by building this no wrong door service delivery approach is reducing the stigma, improving accessibility, ensuring equitable service for all families in community, and building a well-coordinated, responsive system and where we can create healthier, stronger communities and families feel well supported. And as we're trying to connect this into the 5-year prevention plan, go ahead and go to the next slide. As you know, some of you are familiar with, the California 5-year prevention plan under Families First that really identifies 3 main pathways to prevention. One is through the child welfare path, the other is the probation path, and then the community pathway. What we've been doing here in Santa Clara County has been trying to solidify what we currently had in existence, as well as implement more upstream strategies, which the SAFE program is one of those. If you go to the next slide, what we're doing here in Santa Clara County is fully aligning to the 5-year prevention plan, ensuring that families receive the right support without unnecessary child welfare involvement. The county is really committed to expanding upstream prevention efforts, ensuring that the families can access voluntary community-based services at the earliest possible point. Our approach supports the state's goal of reducing foster care placements by keeping families safely together with the right interventions and the right level of supports. And we've been doing this by building out the SAFE program, the Strengthening All Families program. This is the families that we get through our call center or hotline. Families then are either evaluated out or we label them as non-reports. They don't need further investigation. So these families are then automatically referred to our community providers through the SAFE program. And then we have also differential response. This is a diversion of a post-case closure program, diversion where we refer families as they're getting closed by either the referral after investigation or their case is getting closed, and making sure that families are getting connected to community and referred to community prior to the case closure. And then we also have what we call the non-court voluntary services. These are informal voluntary family maintenance cases that we have, child welfare has oversight over them. So as you can see, we have a good array and really are supporting families at different points in time. Now, as what we've been trying to do also as part of aligning to the community pathway for under the state is we developed this community pathway journey. As you can see and you saw in the prior slide, you know, we have to look at the access points, child welfare, probation, and community. By processing the alignment with the state's vision, we're really structuring the community pathway here in Santa Clara County and aligning it to our vision of a no wrong door service delivery model, ensuring that the seamless access to prevention is there, that the state prevention framework emphasizes that families should be able to receive support at any point. So when the family is in need, regardless of what entry door or entry point they come through, we're assessing them and evaluating them holistically by using a biopsychosocial assessment or the CANS assessment, and as well as using the protective factor survey to making sure that we're evaluating the impact that we're having. Under Families First, as you all know, it's also needed to ensure that we create a prevention plan with services and supports to address the needs, disconnecting families to evidence-based practices, substance use, and in-home parenting skills, and also monitoring the safety and well-being. So we're making sure that this journey is really focused on family and making sure that they're getting connected to the right level of care. So this is part of the work that we've been doing in building out the no wrong door service delivery model. As part of this work, we had intentional conversations with all of our providers of what is it that they need to be able to build this out. In talking to them, you know, we found that a lot of the processes that they have are already in place for a reason. And so we're working closely with the providers to see where does it, within the process, can we implement the risk and assessment processes? At what point do they contact us to confirm candidacy? And at what point, you know, do they create the case plan, and what levels of supports do they need to make sure that the case plan has? This is a lot of work, a lot of conversations, a lot of technical assistance that is required to be able to help and build this out. So this is one of the things that if you want to walk away with anything today, make sure that you're aware that there's a lot of technical assistance, a lot of conversation, partnering, collaboration that needs to happen in order for this to really be solidified and take hold. By building this, we're really hoping that we're ensuring families can move fluidly between tiers without needing to restart intake processes, as well as ensuring that there's established formal partnerships across different providers. So if the provider doesn't have a service that the family needs, they can easily do a warm handoff to other community-based organizations without any interruption in the services. So the hope is that we build this ecosystem. It will well-supported infrastructure here in Santa Clara County to serve the families at any access point, and we're providing them with the right level of care. Go ahead and go to the next slide. Now, as part of the conversations that we've been having, we realized that, you know, we needed to have conversations of what is the risk assessment that needs to be placed? How do we make sure that, you know, we evaluate for candidacy determination? And we initially thought, oh, we need to create some tool since the state hasn't provided us. So we went ahead and created a tool, which you'll see a copy of here. But in conversation with some of the providers, they're already assessing risk. They're already, to some degree, you know, in their initial intake and screening and assessment process, they're asking all these questions already. So rather than giving them another tool to use, and that's required, and embedding another layer in the process, we are working with them very closely to see at what point do each questions make sense to be asked, where in the process do they need to evaluate this, and then at what point do they have all the information necessary to then say, okay, there's enough risk factors here that this child can be at imminent risk of child abuse and neglect, and they also meet the candidacy determination. So that's all part of the work that we've been working, part of the technical assistance and training that we've been providing, and conversations that we've been having with a lot of the providers. Go ahead and go to the next slide. This next slide is actually a good example of conversations that we had with some of the providers of what does each tier need to look like? What does the initial contact with the client look like? At what point do we do the screening? Does the frontline staff really conduct that preliminary intake, screening, and assessment? And at what point do we create that client profile where we are assessing risk? And so this flow here, this process here shows, you know, all those intentional conversations that we've had, which with the providers to map all this out.
Right.
Once we mapped all this out, then we figured out, okay, this is, and in tier 2, this is where the risk assessment would need to happen. When you are determining what services, what is it that the family needs, this is where then we would look at the risk and do the self-sufficiency assessment and conduct the confirmation of candidacy determination with child welfare. So this visual here is really laying out all the process and intentional conversations that happen in months of conversations with our CBOs. Once we mapped this out, we had a clear vision of what this process can look like. And so this is where we are in the process now. We're actually having intentional conversations with our providers that we currently contract with to expand the initial Strengthening All Families program to really embed all these processes in the work that we do. And with that, I'm going to go ahead and pass it over to Rebekah so she can talk a little bit about what we've been doing with the SAFE program. Rebekah? Did we lose Rebekah?
Can you hear me?
Yes, we can hear you now.
Okay. Wow. I started saying that we initiated the SAFE program just short of a year ago. We're a few days short of, and it has, it feels like it's a living, breathing program because the shift from child welfare into prevention is very different, right? The purpose of Strengthening All Families Equitably is catching families that we do get calls in on for the Child Abuse and Neglect Center. We call it the CAN Center, but don't rise to a level of investigation, right? So these families have some risk factors that we really want to connect families to with a community-based organization to start building those natural resources, right? One of the great things is because it is such a new shift, and Patty has been a great partner at a higher level on a management end. She has really given us the ability to look at data in real life, right? Like in the breathing, in the moment when we're getting these referrals, what does it look like, right? What themes are we seeing? Excuse me, I'm going to move my screen over a little bit. Thank you. So currently, when we originally started, one of the major eligibility criteria was that their families would not have any substantiations. However, with changes to welfare and institution codes, all county letters and things that come out, we started looking at our substantiations, right? Sometimes we get grandparents that are now parenting and they might have had a substantiation a long time ago. Or it was a really young mother and now she's got older kids and maybe she was unsafe then, but we're also talking about 15, 16 years later and things have been different for her. So we really had to look at substantiation because the threshold for removal also changes, right? And it has changed because as the first presenter was talking about our statistics, those numbers are decreasing. The focus of SAFE is to support the families in real-time need, right, with community. And our partners here do a wonderful job making that initial contact, trying to get families at different times of days, even on weekends and evenings, and making that first contact and starting that intake assessment. If parents, if family, it's not always parents, if caregivers agree, right, to services, then they're starting that assessment and that intake right away, right? Because if we catch it early on, then not only our engagement numbers going to improve, right, in the long run, but we're also not going to have these families come back with maybe more risks next time, right? Let me move slides. Did I go? Okay. So currently, the way the staffing works, internally, I triage referrals because I do look and ensure that there aren't any open cases or any open DFCS referrals, meaning investigations. Because if there is an investigation, then that emergency response social worker has access to a different program, right? They have access to either cultural brokers or differential response, which is a prevention program, right? If they don't have an open case or an open investigation, they're referred out, and me being that SAFE coordinator does the internal triaging, that background work, and then they get assigned to our CBOs, or community-based organizations. They have their supervisors. They also have case managers and community workers. So that's also a different shift to focus more on having more community workers and case managers, because those community workers are making that contact and they are able to give resources, right? They're more knowledgeable about the resources out there, and then the case manager can take care of the longer term, more intensive needs. One of the current, I should go back, one of the just topics that came up, for example, during our multidisciplinary team meeting, again, this is a living, breathing program, is our current climate, right? In Santa Clara County, we have had ICE and DEA out looking for undocumented residents, right? So one of the conversations that came up is the fear in our community members, right? If they were hesitant to engage in services before, now if they're undocumented, there's even a greater risk for them, right? So part of that conversation was talking about, is there a need to shift the community worker to focus more on immigration needs for our populations right now? So the great thing about our CBOs is that they have a long history in our community. They know our populations very well, and they are very responsive, right? So this theme came up through one of the supervisors, and it is something that we'll continue to discuss. And as each agency develops a strategy, then we encourage them to implement that. So the majority of the work that gets done in SAFE with the providers is care coordination. You all might hear sometimes families like, I have a case manager over there, or I didn't even know I was in services. Things can get really confusing and disoriented. Sometimes, there's communication breakdown, or there just isn't an agreement. Maybe that parent doesn't agree with what the school is saying about their child, right? And the school doesn't agree with mom's observations or whatever it is. But SAFE comes in, those community workers, the case managers come in, assess what the needs are, and make that linkage right away. So it's more than just a warm handoff. It's ensuring that communication is made, right? That there's clarity, that if there is already a therapist, that family knows how to get a hold of them, that next therapy appointment has been made. Maybe they've even discussed what the concerns are, right? Most of our needs come in most of our families have basic needs. So utility, rental assistance, issues with housing, food, clothing sometimes. And then the next category would be intimate partner violence, mental health, and substance use, right? So our community-based organizations are very well versed with, if they don't have it in-house, they know how to access it, right? So if they have that service available within their agency, it is a smoother, right? Warm handoff is a lot faster. If not, then they carry that family through connecting to the next agency, and possibly if there isn't a duplication and both services are needed, then SAFE can continue to do some case management while the family maybe receives specialty care in another area. I did briefly mention our multidisciplinary team meetings. So these are meetings that occur bi-weekly. It is at least 3 different team members, disciplinary team members. So it would usually be myself, a couple of supervisors. I do have some support through a administrative assistant or a client services technician. So sometimes they join in as well. And that partnership in SAFE goes beyond just my program. There are times where also, for example, the cultural broker analysts will also come into these meetings, right? Because there sometimes is just questions and overlap. And since we are prevention-based, it's great for us to know exactly what's going on with each other's programs, right? So we do meet, it's virtual. initially I thought, man, we're going to spend a lot of time talking about complicated situations. That's really what I thought, child welfare hat, case manager, child welfare hat on. But as we started to meet, we just realized, evaluate out and non-reports. Some of them are complex. Those are families that we might get a couple calls a year on, and most of them are not, right? And sometimes we're not even clear about what the need is or what the concern was when that call came in. So our MDTs are really spent more, of course, if they have questions regarding a specific case or something that is a little more complicated, then of course we consult. But most of it is really talking about the themes that we're seeing, right? And being able to respond and adjust to the immediate need. We also do spend some time talking about program development, I guess, because we tend to go that route. But it is really helpful for me as an analyst who no longer carries cases, right? Who is a little bit removed from the community at this point, to really hear back from our providers in those sessions, right? Because then I can take that information back to Patty. But for the most part, anything that is super complicated, I wouldn't even call it super complicated when you're used to a threshold of child welfare, we're maybe, way up here. But these MDTs are really a time to be able to talk about practice, right? Bat around some of those ideas on how to remove barriers for families, and then discuss some of those themes that do come up. So most of the time when we're having conversations about our cases, it does have a tendency to be either around severe intimate partner violence or severe mental health. But those are rare and far and few in between, I believe.
Rebecca, you're sharing the wrong slides.
I went in the wrong direction. There we go. I went the wrong direction. There we go. And as I'd mentioned, our community-based organizations, Gardner Health Network, who we don't have represented here today, which is A-okay. They're probably pretty busy with a couple of the other programs that they are running for us as well. Pacific Clinics, and Mindy Davis is here representing Pacific Clinics, and Rebecca's Children's Services, Maria Alejandra and Damaris, are both from RCS. The unique thing about these three providers is that they all ended up with almost like an area of specialty accidentally. So Gardner Health Network is our only agency out of the three that can provide services to adults. They have an adult side to their services, and they also have medical clinics, which includes WIC, Women, Infant, and Children, and a couple of other programs. So when there are families that do have maybe some medical complications or needs, or difficulty accessing medical care, when they might need help with those general benefit or Medi-Cal type of applications, if the adult is the one who appears to need the more support than the children, then those do get assigned to Gardner, as well as being mindful that we don't want families necessarily to travel long distance. So we also keep families geographically, right, with these agencies as much as possible. Now, Pacific Clinics, they are our holder for our crisis stabilization unit here in the county. So for Pacific Clinics, they naturally end up getting all of our youth that are post-crisis stabilization or psychiatric hospitalization, because my assumption is that they have had some communication with Pacific Clinics because of that process. So it is not an unfamiliar agency for them. They also have the Center of Living with Dying and a sexual abuse survivors group that is for the family. And the groups are divided by parent, and then the children are according to age groups, right? So if those themes do come up in the referral that I received, then those families are more likely assigned to Pacific Clinics. Rebecca's Children's Services is, well, Pacific Clinics is also now in South County, and they're all able to provide services throughout the county. But Rebecca's Children's Services has a long history in South County, and folks in the Gilroy-Morgan Hill area, as soon as you say RCS, they know exactly who we're talking to. So they do receive what we consider our South County zip codes. But on top of that, they have a culinary program for our transitional age youth. So if I have a transitional age youth who looks like he needs support, they're more likely to get them. As well as a lot of early childhood education programs. So, and they have a wealth of parenting classes as well. They hold some of our parent education contracts, as well as Gardner, right? So they have access to a wealth of services down there as well. So they end up getting divided in that way based on need and zip code. Now, if, however, I, for example, I read the referral and I'm like, oh, this one's perfect for Pacific Clinics, but somewhere else I catch that they are a Gardner client, then I'm going to refer them back to Gardner instead of Pacific Clinics, right? And just trust that Gardner will assess, and if there is a need for that secondary program through Pacific Clinics, then they'll do that coordination of care.
Thank you so much, Rebecca. So if you can stop sharing, we're going to go ahead and go into and hear from our partners of Pacific Clinics and Rebecca's Children's Services from their experience, and they can share with us, their success as well as some of the lessons learned. So Rebecca, if you can stop sharing. So I want to go ahead and invite Damaris, Mindy, Maria Alejandra, and Rebecca. So I have a couple of questions for you. First of all, I want to thank you for partnering with me and doing this. I know it took a lot of your time to really think about what we were going to talk about today. But here's my first question. I'll start with Rebecca. Rebecca, from your perspective, what have been some of the successes of the SAFE program and the successes in really that you've seen in engaging the families in this program compared to other programs?
No problem. So one of the details I left out was prior to SAFE becoming a program for Santa Clara County, we were trying to manage our evaluate outs through differential response. So that included myself calling families. It's very different when I call families because I am a representative of DFCS, Department of Family and Children's Services. Most families say, what does that mean? Who are you? And then I make that connection. You've heard of CPS before, Child Protective Services? And they're like, yeah. And I'm like, that's who I work for. Because I am a representative of DFCS, I want to make it very clear to families who they're speaking to. And then I quickly switch over to from prevention, right? Which means I'm not knocking on the door. It doesn't mean we have concerns with parenting. One of the things I learned very quickly in engaging families that way was not to focus necessarily on the reported information about parents' concerns. Like, for example, I'm going to use little Jimmy. Little Jimmy, got in trouble at school. He told his teacher he's scared because he's going to go home and he's going to get a whooping, right? He's going to get whooped. Instead of calling the parent and saying, hey, there's a concern that when little Jimmy doesn't do well in school, you hit him. Because again, I don't know what's going on in the family. I'm just a phone call, right? We connect it back to what the concern is with the child. Because in that referral somewhere, they're going to say little Jimmy couldn't focus. He looked really nervous. So then I focused on that, right? Like little Jimmy appeared to maybe have a hard time focusing on schoolwork. It seems like he's really worried about some things going on at home. Have you seen something similar? Can we connect you to services? Now, again, I'm still CPS, so families, for the most part, a lot of times when they heard that, they were like, click. If they let me go through my spiel, we did not have good outcomes that way. I mean, we had less than a 1% opening rate for families in differential response evaluate out in a year. So calendar year, full-time, me managing those referrals. The fantastic thing is when you switch over, and now my community service providers are the ones making that contact, they have a different relationship, right, with the community. They're known in a good way. RCS, Pacific Clinics, Gardner doesn't come and snatch your children away, right? There isn't that fear. Now, mind you, they're still managing that high level anxiety that parents hear, right? Like somebody's concerned about me and my kids, what's going on, but they're much better at engaging. They're much better at just calming folks down and really selling what services they have, right? Again, it's their services, it's their agency. They know all the great work that they're doing. So our outcomes improved greatly. I mean, we were over a 30% engagement rate within our first 6 months, which is enormous, right? Huge for us. And taking into consideration, right, that even though we are starting this prevention work, it's going to take community a while to really trust that we're not trying to trick them, that we're not, sending somebody else instead of us to report back to us. So as some of that, like we said, shifting from mandated reporting to mandated supporting, as that shift starts to happen and community sees it live, right, and in their neighborhoods, then I think that engagement rate will also increase. And once our next fiscal year is really going to be looking at this fiscal year when we finish our annual report. I really want to be able to drill down, and look at that data and see what it tells us, right, in the long run, and how it can inform us of where our gaps are, right? What services are most needed. So it's great also in that because I do go over almost 2,000 referrals a quarter, being able to do that also gives me an idea of what's going on in our community with folks that are mandated reporters, right? Where are the gaps? Because there are times where, these referrals are things that happened 10, 12, 8 years ago. So some of that education, right, for us internally on how to better educate our community members and how to move towards that mandated supporting will also help reshift some of that funding back into our community, right? If we're not taking a bunch of calls and having our workers, complete that process, that's money that can then be diverted into prevention, right? Into our community-based providers, because we get more for our money that way, right? I mean,
Yeah.
Patty and I, as soon as we got that contract, Patty was on board with me where she was like, yep, it costs us a lot more to pay me to sit there and do that job full time as opposed to maybe managing 2 or 3 programs, right? Overseeing 2 or 3 programs. So learning how to shift our dollars has been fantastic. And being able to articulate what the need is. We undershot the need, no lie. Part of it was that the definitions for non-reports were changing and our definitions for evaluate out were changing through the state. So then we had to adjust, right? I was like, there's no way we'll have enough non-reports the way this is going to meet this contract. Because essentially now our non-reports are family members that we don't have any information on. We don't actually have names, a phone number, an address, right? And most of our calls are going into an evaluate out. So that quick shift, it was a quick shift. Again, if I wasn't able to catch that right away, right, then we would have had a gap in that response. But being able to do that, it was phenomenal. And having the partnership, not only just, within DFCS, but our community-based organizations, because they also have other contracts with us and provide different types of services, they're able to say, hold on, Rebekah, I see this, or hold on, let's have this discussion. Another great benefit that I feel is between the 3 agencies, they have their own partnerships, right? And it's great to be able to leave a meeting, a virtual meeting, and then allow them to discuss SAFE without me present, right? Without DFCS present. Let them, whether they're frustrated with me or some, government agencies can be difficult to challenge. We have that communication and that trust, right?
Yeah, and you highlighting that collaboration and partnership, it has been one of the big successes of this partnership as well. I'm going to go ahead and, for the lack of time, we're going to go ahead and ask the same question to Maria Alejandra from Rebecca's Children's Services. What have you found successful in engaging with the families and addressing their needs?
Thank you, Patty. Yes, so we have, first of all, I think being genuine and approachable is essential to engage the families. We also have a system where we make 3 attempts to connect with the families by phone, leaving messages, informing them about what we offer and what support they can benefit from. We ensure that we are not there to to take away their kids, and making sure that we're there just to support them in the time of needs. We remain flexible, delivering services, offering support through various methods, including in person, telehealth, and like Rebecca mentioned at the beginning, in different times and days of the week. So we have staff that are representative of our community that we serve. We work directly with the families with the resources they need. So those are the way that, what we have done. We provide families with detailed information about the services that we have available for them, ensuring them and making sure that they understand the benefits of participating in our program. So
Thank you. And Damaris, you work very closely with this program. Any other successes that you've seen in engaging families?
Ale mentioned a lot of what Rebecca's Children's Services already does, but something that I do want to mention is something Rebecca mentioned earlier, how something that has worked is collaborating with the other agencies that are doing the same thing we are, and hearing their ideas and hearing what's working for you. And just having that partnership, I think it's great, and having that opportunity to come together twice a month and talk about what we need help in, or concerns, or what can we change, and engaging with these families.
Great, thank you. And now I'm going to go ahead and ask the same question of Mindy. Mindy, from your perspective, what have you seen found successful?
Hi, everyone. Yeah, I would say it's really, similar. And I mean, we've implemented a lot of strategies, right, to support engagement. But really, we found that the initial call is really a critical touch point, right, to establish meaningful relationships with the families. We really try to prioritize, letting them know what the purpose is, right, of our program, which is really to connect them to the needs that they have. And we really do emphasize that, our program is completely voluntary, and we offer a lot of flexibility, for our families, just to really ensure that they feel comfortable and supported throughout the process. And then, we also just really try to understand the family's background and their needs, and just really making sure that we're meeting families where they are, and just really fostering a non-judgmental environment, which then creates trust, right? And then encourages openness and receptivity to services. And we found that, this approach has been instrumental in strengthening the relationships and promoting just sustained engagement. And, just a quick note, as a result of these efforts, we have successfully supported over 200 families and facilitated over 600 linkages to just general resources, right? Whether it's like housing, food, mental health, financial, educational, legal, and just the list goes on. So, yeah.
Well, thank you for sharing. And now this question goes for the three of you, Mindy, Maria Alejandra, and Damaris. Can you share what has been some of the challenges and opportunities in this journey that we had in this past year as part of the SAFE program?
I can go first. One of the major challenges that our team has had in engaging families or in this program is establishing that trust with the families. A lot of times these families are very concerned how we got their phone number, what agency we're representing. And they have a lot of questions and doubts, and sometimes they feel, is this a scam? So there is that initial worry of, are you authentic? Are you an authentic agency that is here to help me? And I believe it has actually risen due to our country's national climate right now. That worry where families are wondering who we are, but something that has helped, and how Mindy mentioned as well, is that initial contact that we have with families, making sure that they trust us, and they know who we are, and us offering our services and telling them how they can benefit from being part of our program.
Thank you, Damaris. Mindy.
Yeah, I mean, I would say it's very similar to, I think, Damaris. I think it's nice when we have those separate meetings because we realize that we have the same challenges, which is really reaching families and engaging families, right, in our program. Yeah, they expressed, hesitation, apprehension, just uncertainty, right, about the support that we can provide. But I think in turn, this challenge just also presented an opportunity for us to build those positive relationships and really alleviate concern about just provider involvement. Even for families who felt overwhelmed by their circumstances, we really remain committed in just really being able to provide just meaningful support. And to do so, we really identified key opportunities, right? And we developed more concise resource presentations for families, and really just to ensure that they still receive the information that we can provide. So we introduced a flexible outreach approach, in offering maybe 2 to 3 calls. And in those calls, right, we made sure that we provided that presentation regardless, right? And also making sure that we maybe provided flyers via text, via email, anything, really just for them to be able to access those resources. And in the hope, right, that in the future, then maybe they will access our program or just other resources. Yeah, and then just, these adaptations have significantly improved our ability to link families to essential services while just, fostering a positive and supportive experience for them. Yeah, and just by implementing these strategies, we hope that we're leaving a good impression, right? And just really encouraging families to engage, whether it's our program or just other programs, just to be able to access the resources that they need for them, right? And for their families.
Great, thank you. Maria Alejandra, anything else to add from your perspective?
Yes, thank you, Patty. Something, a key opportunity that we identify is raising awareness about the resources that are available for families in the county, and also the opportunity as a director that I have to really spend time on resources and making it very essential to have connections within other agencies. So when we refer the families, we have key people that we refer them to, so families feel more at ease when they get those linkages. And our resource data and list that we have available for other programs is very precise. It's up to date. So we had to spend time doing that and making sure the resources that are available for families are true. We understand them and we know how to refer the families to that, and that transfer it into the rest of the prevention department here at RCS, and also to the agency. So it's a ripple effect that's happening.
Yeah, I really appreciate the insights that you guys bring into the table. And as we're getting close to the end of our presentation, I do want to highlight, when we first started with the SAFE program, right, we thought about and we started having our meetings about this well-structured program, and it was going to do A, B, and C, and this is how we were going to do it. But as you heard everybody talk about, we had to pivot as we started to learn and use the data and learned as we were doing that, we had to be flexible and adapt to what we were seeing and how families were coming in and what they were asking for. And because these are voluntary services, right, the hope is that the engagement with these families at these FRCs and by these providers will actually ensure that the family keeps coming back to addressing whatever needs or whatever stressors might happen in the past. Now, I do want to ask the three of you, Maria, Alejandra, Mindy, and Damaris, in this last year, in this journey, we learned a lot. We pivoted and adapted. What would you share with other counties that are looking at doing something similar? What are some of the walkaways that you want them to take away from today's presentation?
Who wants to go first?
I can go first. I think one of the main things that Rebecca's Children's Services as an agency has found very helpful is how funders have funders that remain flexible. And I can say this because being part of the SAFE program, the county has remained very flexible with us. And like you mentioned, Patty, that's so important when providing these services for these families. And the support and the goal of becoming a comprehensive, like a one-stop shop for these families has to be the same with the funders. Our goal should remain in line with our funders, and how we actively seek funding that aligns with the vision and inform the funders about the no wrong door approach, and having the requirements that they have for us also being aligned with how we provide the services. So I think that's really important, something we have learned, and how we can help the families even more and provide these services for them.
And Patty, I'll just continue with that same path and just say that to be able to do that as a department, we had to have extremely good communication with the team, you know, strong communication and collaboration with other in-house programs, in-house services, and outside agencies. And, you know, we had to take the time to be very knowledgeable about the communities and resources that are available for families outside of our agency. So those are the things that I would recommend people to do. And then Mindy.
Yeah, I
Thank
think I'm a little more, just more towards the program. I mean, the SAFE program has really been instrumental in just empowering families and caregivers to address their needs. And it's really, you know, aside from just thinking them like a one-stop, like somebody was saying, to resources, it's really an opportunity to really enhance the caregiver's confidence and advocacy skills, and really support them, you know, by either hand holding and coaching them and walking through all the resources and steps, and making sure that they feel confident, right, to be able to access those resources in the future, whether it's for them or for their children, right? Because at the end of the day, that's the goal. That's our goal, right? We want to make sure that they are empowered to access the resources. And I think just the SAFE program is instrumental in being able to provide that to these families.
Absolutely. I want to thank all of you to, you know, really sharing the journey with everybody here and being a thoughtful partner in us building a successful SAFE program. And I do want to open it. I know we only have about 10 minutes left, and I do want to open it up for any questions that any of those present here might have for us. If you do, feel free to, you know, just go ahead and unmute yourself or put your question in the chat.
Hi, I'm Natalie Davey from Sacramento County Child Welfare, and I have lots of questions, so I don't want to take up all the time, and maybe Patty or Rebecca, if you're open to connecting outside of this, that would be great. But I was wondering if you are using the Title 4E funding at this point, or how are you funding the SAFE program? Is it through existing contracts or?
So yes, we are leveraging the FFTA dollars as well as the Certainty Grant dollars to get this launched. And of course, we're also working closely with our managed care plans to see what can be sustainable long-term as we are looking at other funding sources, because this was meant to be, you know, seed money, right? And so now the work in the back end is how do we sustain this amazing work that we already started? So we're partnering with the managed care plans, and we're looking at what other grants or opportunities are out there that we can make available to our providers. And thank you, Natalie, for that question. Any other questions?
I would just wonder, how long did it take you all to set up or to do the design component of this and then to really start implementing?
We were lucky enough that before we had all this, our CPP in place, we had piloted a neighbor-to-neighbor program with a partnership with First Five locally here. And what we learned from that was actually used to develop out and include in the development of this program. So if we're looking at a time frame, from the time we piloted the neighbor-to-neighbor, that was about 2 years. And then by the time we got everything and used all the data and the lessons learned and reimagined the new program, that was another year. So in March of last year is when we launched SAFE. This is when we started sending the referrals to the providers and started, working with them. But prior to that, it took a good 2 to 3 years to get everything set up, including the piloting phase of what was prior to SAFE, the neighbor-to-neighbor program.
Thank you. That's great. I do have a question in the chat from Natalie, just being open to having some more conversation about this. Patty, I think right, from the work, and as there's so many counties that are really just hungry to see somebody having done it in a sense, right? I mean, I know you're all in a learning phase still and trying to figure out sustaining, and but I think there are so many people who would be really excited to hear what you all have to share and to see what, to see the slides where you can actually visualize something. So there's another one. Laura has the same question.
Yes, no, absolutely. And I do want to invite anybody to go ahead and reach out to me. I'm going to go ahead and put my email in the chat. And we can definitely connect and share the amazing work that we are doing here locally.
Yeah, it makes me think about maybe it's a webinar in the making.
Could be, sir.
All the lovely panelists here, right? That's where my brain goes, is because if 5 people on this workshop have those questions, 500 have them, right? And so what's the way to use you all's time effectively to not have to talk to 500 separate people, right? And instead be able to deliver that information to a wider audience who's really hungry for it.
Absolutely. And that could definitely be a conversation, Sarah, that we can have with Strategies TA
Sure.
and CalPrevent.
Absolutely. Thank you for your openness.
Well, I do want to appreciate your attendance here today. And also, I want to get a round of applause to my partners here, Mindy, Maria Alejandra, Damaris, and Rebekah, for really joining and partnering with me and bringing this information to you all today. Thank you, everyone.